Very good evening, friends. Meeting again in the session of Materia Medica. We are discussing the Natrum Mur since last 2 days from Allen's keynotes. We have learned certain aspects of Natrum Mur. We have started with the constitution of Natrum Mur. Then we have discussed the mental psychological aspect of the Natrum Mur. In yesterday's lecture, we have learned the GI tract aspects, the respiratory problems, the heart's problem, all cardiovascular problems in last lecture. And there are many more. Those who have not attended those lectures, my suggestion is to go with the videos uploaded over there in the YouTube. Listen them so that you can understand the whole concept of Natrum Mur. It is a very big remedy. In fact, it has a multiple aspects, a polycrest. And that's why this remedy we have to understand in different parts. Every time we start with the case, and today I will going to share wonderful case which I have treated in my practice. It was wonderful because I have treated the DM cardiologist who came, who was young enough, nearly about 29, 30 years of age, and who was brought right from Mumbai to Sangamner, and who used to get a severe urticaria, and many times he used to get that allergic reactions. It used to produce angioneurotic edema, and many times he was nearly on the phase of death, and he was brought out during that shock period by giving intracardiac adrenaline injections. It was so severe. Being a cardiologist and HOD in the cardiologist department, used to get admitted 2 to 3 times and taken out with the help of intracardiac adrenaline, and he used to get a severe allergic reaction. He was treated by all skin specialists, then the vascular surgeons, vascular physicians, then the many physicians, neurologists, everyone have seen this case. It was he was diagnosed sometimes non-specific vasculitis, sometimes autoimmune vasculitis. Many names were given, chronic urticaria. Lot of names were given to this, and the person was not getting cured. Whenever the attack comes, he used to go into the panic and he used to suffer a lot. So he was brought to me to Sangamner for homeopathic treatment. I took his case. It was nearly about 1.5 to 2 hours period I have given to him because the case was interesting. The whole story was revolving around his life. He was absolutely normal till MBBS, even he was past MD. He was in relationship with one girl right from MBBS. Both of them have done the PG, and he got the admission to the super specialization DM. And during that period, something happened in their life and the whole relationship was broken. And his life was spoiled. He, he got so much disturbed in his life that it was very difficult for him to remain alive without her. He was so involved with her, and it was not possible to remain him alive. Many antipsychotic medicines and lot of things he has taken to come out of that situation, but everything was in vain. Later on, because of those allopathic tranquilizers, then the mood elevators and all those drugs, he came out little bit, started working again, but developed this skin problem. It was so severe that he went into such a grave problem. See, this is a disorder which is of type 1 of variety of the, type 4 variety of the mental diseases. The cause was psychological, reflecting at the physical level. There are 4 types of mental diseases in homeopathy. The first one, which is called as somatopsychic. The second one It might be because of some acute exciting cause. Third one, a confusion between first and two. And fourth one is the psychosomatic. And this was the psychosomatic disorder. And it was very clear that he had that right from that incident. He was in a little bit depressed mood. He was taciturn, very less. He used to talk very less. Even during consultation, he was opened up after a long time. It took me a long time to open his case, and then he opened and he wept during consultation. He said, first time I wept with in front of someone. Then asked, then what you have done? I used to weep, but I used to weep in bathroom. He was a loner. He used to remain in one room. He never wants to get mixed with the people. He used to brood over the things. He used to dwell on the things which has happened, those past things, and then he got so much disturbed. Then I took physical generals, and there was very few features which are again indicating his face was greasy. Even his hairs were greasy with a dandruff over there. Then another thing, he used to crave the salt. In everything, he used to put the salt. Then I asked about the dreams, and then he refers that I used to get the dreams of thieves, robbers. So case was very clear for me. It was clear-cut Natrum Muriaticum. Here, I have started with Natrum Mur 1M, 3 doses, and kept him on placebo, simple placebo, because case was so clear. The magic happened after the first dose of Natrum Mur. I have treated him, I think, in the most probably in 1985, no, around 2005, I have treated him. Thereafter, he never had an attack of vasculitis, he never had attack of urticaria, and it was completely cured with first 3 doses of Natrum Mur. He was kept on placebo for nearly about 6 months and nothing required thereafter. And he was completely cured. No more medicine, no more allopathic medicine, nothing was given to him. It was wonderful to show this. He says that you publish my cases everywhere because I have this much of material, reports, and nothing is working. But you have your this medicine worked so beautifully that I never had a second attack also. So this is a wonderful remedy. This is a wonderful remedy one should not forget. And that's why we have to learn the remaining aspect of Natrum Mur in today's session. Open your Allen's notes. We have finished up to the heart's pulsation shakes the body. That's what we have covered. The common feature of the spigelia along with Natrum Mur. Then the next sentence is hair falls out when touched in nursing women like sepia. In that case, we have discussed in yesterday's lecture. I have treated the nursing woman, hair fall in nursing woman with the help of Natrum Mur. The face is oily, shiny, as if greased. Whole face is shiny. Merksol is one important remedy. Don't forget the Merksol, the Plumbum metallicum, the Thuja, and Natrum Mur. Natrum and Merk, they are quite a in the grade 1 because they always have this greasy face, shiny face. Even nose is shiny in Natrum Muriaticum. For the bad effects of, see, these are the bad effects of, and then there is a colon written. Bad effects of anger. So whenever person gets angry, the problem happens to be there, caused by an offense. Then bad effects of acid food. Acid food means anything which is acidic in nature. So sour things are always acidic in nature. So anything which is acidic in nature always causes a trouble for Natrum Mur personality. For the bad effects of bread, and that's why there is a severe aversion to bread in Natrum Mur. Bad effects of quinine. This is one more remedy. Malaria treated with quinine and having a long-term effects, hazardous effect, Natrum Mur, one should not forget, very important remedy to bring that patient out. For the bad effects of excessive use of salts. So there is a craving for salt, but I want to tell you, there is also a aversion to the salt in Natrum Mur. If you open the Kent's repertory, in the desire for salt, Natrum Mur is given for 3 marks. But in aversion to salt, Natrum Mur is given for 1 mark. So it is a rare symptom of Natrum Mur for aversion for the salt. Bad effects of cauterization of all kinds of silver nitrate. Natrum Mur is the remedy for warts. It is psychosyphilitic remedy, psychotubercular remedy. So warts are very important. Warts, either cauliflower-like warts or either flat warts on the palms, on the back of hand. Generally viral warts which appears on the hands. And if one cauterize it, either with electric cautery, either with silver nitrate cautery, this remedy is very important remedy to be utilized. Because cauterization of warts always causes a trouble, more internal disorders. For the bad effects of grief, a long-lasting grief. This fellow who had a grief for 3 years suffering from vasculitis, a long-lasting grief always causes a trouble. Bad effects of fright, that is also one important thing in Natrum Mur. Bad effects of vexation. Vexation means santap, tremendous anger, and anger on self is vexation, and it is of severe quality. Bad effects of mortification. Mortification म्हणजे अपमान. That is a very typical feature of staphyagria, the colocynth. These are the remedies where bad effects of mortification. In fact, elements from mortification, staphyagria ranks high. So bad effects of mortification, bad effects of reserved displeasure. Reserved displeasure is the word one has to understand. That means I had a displeasure. I was in a happy mood to do something and someone said no. I was displeased, but I never shows my anger. I never shows my expressions. I keep it inside, suppressed. That is Tapisagria, Natrum. These are the personalities who keeps that inside, broods inside, keeps that grief inside, weeps inside. That is very typical with the Natrum. They never want to show their emotions, and that the anger in Tapisagria, what happens? They get angry like this, but they never has a capacity to express. Natrum Mur never goes into that state, but Mur gets depressed because of that. And then he goes in one side, in corner, woods over there, looks into the vacantly. This is Natrum Mur. Staphysagra and Natrum Mur, there is a difference. Staphysagra has anger, but that is only remains in the physical level, never comes out. Hangnails, very important. Nails, these are very important feature. Hangnails, skin about the nails dry and cracked like graphitis, like petroleum. And these nails have very typical tendency. It gets loosed over there. Herpes about the anus and on the borders of hair at the nape of neck. Herpes, it is a herpes here. Two important things. Keep this word in your mind. Herpes means not herpes like a viral infection over here. Herpes means here ringworm. The ringworm about the anus and the borders of hair at the nape of neck. In the bends of knees, it is hepar and graphitis. But at the hair margins, eruptions are there. They are typical of the Natrum Mur. Graphitis is also a remedy. There are eruptions around the margins of hair. Then warts on the palms of hand? Warts on the palms of hand, those are generally the warts which are viral warts. Dulcamara is one more remedy. The causticum is one more remedy which had the viral warts on their hands. If they are sore to touch, it is Natrum carbonicum. So if they are painful on touch, then it is Natrum carb. Then dreams of robbers in the house, very typical dream of Natrum Mur, very typical. and on waking will not believe to contrary until search is made. So they wakes up, they search for there whether there are robbers, thieves are present, like Soranum. Dreams of burning thirst. So they get thirsty during the dream. That is very typical. Dreams of burning thirst. That is very typical. During the dream, they get thirsty. Fever blisters. Fever blister upon we used to call it Shinubarno. This is very typical. Around the mouth, the eruptions are there and which are generally happens to be there because of exertion. Yesterday I have shared the case. The typical eruptions around the mouth. That was the case. So fever blister like pearls about the lip. That is very typical. Pearls around about the lips. Lips are dry, they are sore, they are cracked, they are ulcerated like nitric acid. Nitric acid, it is more at the cracks at the corners of mouth. In Natrum Mur, it is at the lower lip, the middle of the lower lip, there is a crack. Even Natrum Mur also have cracks, but they are more characteristic of the nitric acid. If it is associated with the cancer, then Condirango is the remedy. If cracks at the corners of mouth with the cancer, don't forget the Condirango. That is the indication for the Condirango in cancer patients. Cracks at the corners of mouth. Then he says painful contraction of hamstring, hamstring spasm. Generally, the sports persons they are having the hamstring spasm whenever they used to play. Ammonium mure, causticum, guaiacum, even rustox, ruta, natrum mure, these are the very important remedy. We have a big role in sports injuries. What happens generally we never use these remedies, but we have ample to do a work in such types of cases. The players always suffers from meniscus injury, and every time the arthroscopy is performed and they remove the meniscus. I treat the many meniscus tear cases with the help of homeopathy completely. I am damn sure that it recovers. So homeopathy plays a very vital role in the sport medicine. Only thing is that we have to approach accordingly. Craving for salt, characteristic 3 plus, calcarea, causticum, lachesis also have the craving for salt. Great aversion to bread. They don't like the bread. Eczema. See the skin symptoms. Eczema. What is eczema? Eczema is a cyclical pattern of disease which starts with the papule. The papule leads to the vesicle. Vesicle ruptures because of scratching. An ulcer develops. That ulcer heals with lichenification, means thickening of the skin. And again on the thickened part, again a papule develops. This cyclical pattern of disease is called as an eczema or dermatitis. This disease is incurable from allopathic point of view. They apply steroid ointments, it gets suppressed, but it never gets cured. Homeopathy breaks this cycle and removes the eczema right from the base. Natrum is one more remedy for the eczema. What he says, eczema, raw, red, inflamed, especially in the ages of hair. So ages of hair, seborrheic dermatitis, wonderful remedy. Psoriatic scalp psoriasis, wonderful remedy. Think over it according to the symptoms. Go to the diagnosis, understand them. You can get the remedy. So, especially in the ages of hairs, eczema aggravated from eating too much salt, eczema aggravated at seashore, and eczema aggravated from ocean overage. Near the seashore, they always gets aggravated. That is the typical modality of the natremia. Their complaints are always gets aggravated over there. Then urticaria. See the urticaria. This is the case which I have discussed. Urticaria acute or chronic. Both urticaria, this is the remedy. Urticaria over whole body, especially after violent exercise. Whenever the person do exercise and urticaria comes, never forget to apply or give the natramur to the patient. Very, very, very specific symptom of natramur. Urticaria is rather difficult disorder to be treated with allopathy. They used to give anti-allergic, till the patient goes on anti-allergic, he is better. If it never works, they give the steroids again till the patient takes the steroids, he feels better, and again recurrence is there. They never get cured with the urticarias. We have ample remedies. One of them is Natrum Mur. APC is another. Rustox is another. Artica urens is another. There are many more depending upon the patient. Dulcamara is very good remedy for urticaria. Urticaria, acute or chronic, over whole body, especially after violent exercise, like apis, like calcarea, like heparsulp, like sanicula, like urtica urens. Then fever. This is again a very important remedy for malarial fever, dengue fever, intermittent fever, and it has a modality. It has a chill at 10 to 11 a.m. That is what intermittent paroxysm at 10 or 11 a.m. Old chronic, old fever, fever for longer duration, not getting covered. Badly treated cases of fever, especially after suppression by quinine. Underline this, very important. If it is suppressed and suppressed, I have shared one case with you. A suppressed malaria led to a patient to the leukemia. That was the case I have treated in 2000, not 2005. It is in 1995 when I started this new clinic. I have seen that fellow in his house, and he was in a semi-comatose state. He was sent by Tata Memorial Hospital. There is a relapse, nothing can be done, and his count was 2,31,000. So I saw him. I found it out. Remedy was not Natrum for that period. That for that fellow, I have given Barata iodide. And Barata iodide, when we started, after 6 days or 4 5 days, the child was in front of me in my clinic. It was surprise to me, and I have done his blood checkup, and the count found to be 3,600 on 6th day after giving Barata iodide. 2,31,000 to 3,600. So this is the magic of homeopathy. We can do that. Natrum Mur is one of the important remedy in such types of cases. Suppression by quinine leading to anything. Think of Natrum Mur. Headache with unconsciousness during chill and heat. So there is severe headache, patient may enter into the unconsciousness. This is wonderful thing. These are things which are mentioned only in homeopathy, which are not there with allopathy. Intermittent fever with sweat, and whenever sweat happens to be there, the pains gets relieved. Sweat ameliorates the pains. That is because the congestion gets settled. Even headache is better by perspiration. That's what we have learned yesterday. So it is because congestive headache always gets better because of it. And now we'll turn towards the relationship part. Very important from practice point of view. Relationship, it is a complementary to Apis, acts well before and after it. Apis mellifica and Natrum Mur, they are complement to each other. Natrum Mur is chronic of Ignatia. So Ignatia is acute, what Natrum is chronic, which is its vegetable analog. Natrum Mur is followed by Sepia and Thuja. If you give Natrum Mur, then you can patient never gets completely cured. You can go for Sepia because Sepia is a big partner. Natrum is one part. Natrum Mur, that's why Sepia complements Natrum Mur also. Cannot often be repeated in chronic cases without an intercurrent called for by the symptoms. So this is a very defecting remedy. You should not repeat unless you give it in LM scale or 50 millisimal scale. You can safely repeat it in 50 millisimal. Otherwise, in centisimal, don't repeat. Give the 3 doses, wait for months. Should never be given during fever paroxysm because it is very defecting remedy. It aggravates the fever paroxysm. So you have to wait for till the perspiration starts, and when perspiration starts declining, it is the time to give the Natrum Mur to the patient for the fever. If the vertigo and headache be persistent, very persistent, or prostration be prolonged after natrum, Nux will relieve. So even after giving natrum, there is a headache is persistent, not getting settled, and patient has already consumed allopathic medicine along with that. Think of Nux, and Nux covers the whole case. These things which are mentioned in the relationship always makes hints in the practice. Then general modalities, the aggravation after 10 at 10 or 11 a.m. That is the time modality of Natrum Mur. At the seashore, already we have discussed, or from sea air, heat of sun or stove aggravates the pain, everything. Mental exertion always aggravates the Natrum complaint. Talking, writing, reading, lying down, all things aggravate the Natrum complaint. So general modalities are very important. The amelioration in open air, like Apis, like pulsatilla, like Allium sipa, the cold bathing ameliorates. It is patient is hot, that's why he likes cold water. Going without regular meals ameliorates. See, this is going without regular meals ameliorates. So whenever patient used to eat regularly, he has the complaint. But going without regular meals, he feels ameliorated. A little bit weird modality. Amelioration by lying on right side. So whenever patient lies on right side, complaint gets aggravated, Natrum Mur. Whenever patient goes and lies on left side and complaints gets aggravated, then the patient is Kalikav. Here, lying on right side ameliorates. Lying on painful side ameliorates is bryonia, it's ignatia, like pulsatilla, because it is pressure ameliorates over there. So this is the remedy which has the multiple facets over there. A very big polycrest. My suggestion to all of you, go through this, go through the Borix Remedica and read that remedy again. Then you open the 12 tissue remedies by Sussler. Read this remedy from the Sussler's book. You will get ample knowledge about this remedy. After reading all those books, whenever you have to increase your knowledge about Natrum, then open the Kent's Mathemedica, then open Tyler's drug pictures, then open George Vitulka's essential or essence of Mathemedica. You will get many facets about Natrum. Then it gets fixed in your mind. You look and you catch, yes, this is Natrum. There is one question, sir, if the patient feels better but not completely, then what we can do? If the patient is not feeling better but not yet completely, that means your remedy is it is partially similimum. Then you have to either go for complementary if it matches, give that remedy. Otherwise, retook the case, find it out another similimum and give that remedy to the patient. Sometimes it might be because of you have not choose right potency. Then think about if remedy is again coming the same one, then change the potency depending upon the case, whether it requires high potency, whether it requires low potency, that you have to calculate, you have to understand. So this is too important. Yes, these questions, these are practical questions and one should ask. My suggestion is always that you should ask questions, but you put it in chat box, so it will be quite convenient for me to answer your question. Okay. So there are many newcomers. My suggestion is that you go through our YouTube channel, read all those remedies from the Allen's keynotes. Second year syllabus, all remedies from Allen's keynotes, they are finished. Only 5 remedies are remaining. Those 5 remedies are not there in Allen's keynotes. Tomorrow, I will going to start with Borix Remedica to explain those 5 remedies from second year syllabus, and thereafter will enter into third year syllabus. So it will be beneficial for students as well as practitioners, because all those remedies are the polycrest which we have learned. In third year syllabus and fourth year syllabus, the remedies are generally not all polycrest, but there are less polycrest and more organ remedies. We can learn that from Borix Remedica. So it is a wonderful way of learning the Materia Medica and to recollect the Materia Medica. So That's all for today. Thanks a lot, and we'll meet tomorrow again at the same time for the Materia Medica at 8 o'clock and 5:45 for the philosophy session. So thanks a lot and good night.